Parents always want to do the best thing for their kids, but when it comes to finding out what is good in healthcare, well, it can be difficult at best. We traveled to Harvard and UCLA to get the latest research on alternative medicine and children. And we have a few suggestions that you might want to jot down if you're interested in herbs for your kids. Is alternative medicine safe for our kids? Although little research has been done to help answer that question, that hasn't stopped a lot of us from using those therapies on our children. Studies in the journal Pediatrics and the Journal of Adolescent Health have found that up to 70% of American children who suffer from severe or chronic illnesses have been treated with some form of complementary or alternative therapy. Harvard pediatrician Kathy Kemper wants to find out what works and what doesn't when it comes to alternative care for children.
We definitely need to do more research on children because children are not just small adults. They metabolize things differently.
Kemper runs a one-of-a-kind research program at Children's Hospital in Boston. She's investigating alternatives such as herbal remedies for ear infections, yoga therapy for adolescents suffering from anorexia, and acupuncture to treat nausea and other conditions in children.
This is Leah's favorite point up here, and how was that?
Good.
Licensed acupuncturist Ellen Highfield believes acupuncture can be appropriate for children. So much so, she treats her own daughters with this ancient technique.
Works so well on minor injuries, sports injuries, the kinds of things that kids get a lot, headaches, stomach pain.
Highfield also works with pediatric pain patients.
I think that once kids see that the acupuncture doesn't hurt at all, and they can begin to feel the effects of it, the raising of the endorphin level, how nice that feels, they're very accepting of it.
An increase in endorphin flow, Highfield says, helps to relieve pain.
Who is wonderful?
Dr. Kemper says young children can respond to holistic treatments such as touch and music therapy.
Children who are a little bit older, toddlers and preschoolers, can use their imagination in very helpful ways to imagine their body's immune system fighting a disease, to imagine imaginary friends or heroes coming to help them deal with things. So even pretty young children can use their imagination to help them get well. And more older children can use more sophisticated techniques such as biofeedback or self-hypnosis or journaling or those kinds of things.
And at the University of California, Los Angeles, children are participating in some of the most alternative of therapies.
Do you feel anything?
Yeah.
What does it feel like?
Fireflies.
Fireflies. Oh, you're feeling the fireflies.
Becky Switzer says she hurts all over. The 9-year-old suffers from fibromyalgia, a condition that causes widespread muscular pain.
It's a disease that I've had this year and it sort of changed my life. I was sort of a regular person until I got it. I couldn't just run around and play, do cartwheels. I used to be a gymnast until this happened. And in December it was the worst, so I had to quit.
So when medication failed, Becky's mother brought her to the pain clinic at the Mattel Children's Hospital. The UCLA facility does use conventional drugs, but also offers alternative options, including acupuncture, biofeedback, and movement therapy, and the services of bioenergy therapist Audrey Easton.
I allow energy to flow through me into them. And what I do is I perceive where there are blocks in their body, in their energy body, and as it clears, it drains into one of my hands, and then I usually release that energy. So I actually feel where there's disease or pain in the body, and then it's released.
Becky also receives massage therapy at the pain clinic. Therapist Nick Kasavac says seriously ill children after surgeries and other procedures can come to associate touch with trauma. So a child may say to him that a movement feels okay.
But if their body is pulling away or tensing, that's contrary to what I'm trying to have happen. So then I have to be sensitive enough.
You should have let me know if it's uncomfortable.
Since she began these treatments, Becky's been able to cut her daily dosage of pain medication by a fourth, and she doesn't need pills to help her sleep.
Really, I rarely get any pain. Now I'm just like a regular person, just running around.
So Becky seems to have improved. But, in fact, only a handful of studies have been done on the effectiveness of alternative medicine to treat children with fibromyalgia, or any other condition for that matter, says pediatrician Lonnie Zeltzer. Dr. Zeltzer runs a pain clinic for children at UCLA.
We want to do the research because we're seeing it work. And obviously not every child needs every kind of therapy, and part of our research effort is to make some decisions based on data on what's going to work best for whom with what kind of problem.
Despite that lack of data, a recent study in Archives of Pediatrics and Adolescent Medicine found that half of pediatricians surveyed would consider referring children to alternative therapies, but even they have their limits.
I think physicians want to be cautious, want to use proven therapies in the face of very serious conditions, and are more open and lenient and willing to accept less rigorous kind of proof for milder conditions.
Kemper has written a parent's guide to alternative care. She advises readers to stick with proven alternatives.
Parents are really doing uncontrolled experiments on their kids when they're giving them herbs because most of the herbs have not been tested in kids.
Kemper follows her own advice. Although she takes it herself, the pediatrician won't use the popular herb echinacea to fight off her own son's sniffles.
The data on echinacea are very mixed. There are some studies from Germany using some products that show it may be helpful, other studies showing it may not be so helpful. There are no studies yet evaluating the effectiveness of echinacea in treating kids with colds or preventing colds in kids.
What's more, Kemper says, parents buying over-the-counter herbs and supplements for their children can't really be sure of what they're getting, since these products are subject to minimal FDA regulation. Purity and the amount of active ingredients cannot be guaranteed. But that hasn't stopped some companies from marketing herbal products for children. So what herbs are safe for children to take? Kemper has a few recommendations, but says it's best to pick them from your own garden. For instance, chamomile is easily grown and has a long history of use.
It's very, very safe, and it can help with upset stomachs, it can help with calming, and it can help with stomach cramps.
Kemper keeps an aloe plant on her windowsill, and she says it's the perfect plant for a busy parent.
Doesn't need much care, and it's very good for minor burns and scrapes and that sort of thing. Another one that I like is ginger. You can get fresh ginger, and it's very good for upset stomach and for preventing and treating nausea and vomiting.
In her weekly web column, Kemper also recommends peppermint tea to soothe an upset stomach. Kemper stresses that holistic care means integrating the most helpful aspects of mainstream and alternative medicine.
So it doesn't mean that you avoid immunizing your child, and it doesn't mean that you avoid going to the doctor for necessary care. It means choosing the remedies that are most helpful and have proven helpful for your child.
Yes, it seems that we're all moving in that direction, combining the best of the West with the best of the East to create a system of complementary medical care. And who knows, maybe in the end, it may help some of us live better and healthier lives. I'm Rolanda Watts on Alternatives Uncovered.